Well, we have a really important show for you tonight because everybody wants to find the best health care that's available to them, but you don't necessarily know how. Tonight we're going to talk about how to find the best doctor in the metro area and how to find the best doctor within your HMO, and also how to avoid bad doctors, because they do exist. No one wants to admit it, but they do exist. And joining me tonight is John Connolly, who is a Ph.D. He's president and CEO of Connolly Medical Publishers, and he has published The ABCs of HMO and How to Find the Best Doctors in the New York metro area. And also joining us is Dr. Darrick Antell, who's a board-certified plastic surgeon at St. Luke's Hospital Center. Well, now, I was looking through your book, as I mentioned to you before. I actually used your book today because my doctor unfortunately passed away, and I had to find a new doctor to get a flu shot, as we did a show on the flu, and they said you have to get your flu shots. How do you pick these doctors in this book?
We do surveys of physicians, nurses, and hospital executives, chiefs of staffs, VP of medical affairs, and presidents. And we ask them, to whom would you send your family or friends in given specialties? And then we do a lot of follow-up phone calls. And after we get a series of nominations and we look over those that have been most highly recommended, we then send them a very extensive data form that they fill out. And then we review all the information on that, do continued checking, such as the thing you mentioned, checking to make certain they haven't been disciplined in any way or problems of that nature, and then we invite them to be in the book.
Do you check, is there any way to check credentials? Do you call up the medical schools or anything like that?
We don't call the medical schools. What we do is we check them against a database published by the American Board of Medical Specialists, which lists their board certification, which is most important, as well as their residency training and medical school.
Dr. Antell, you're in the book.
Yes, I am.
So you're one of the privileged doctors to be in the book. And does this sound like a reasonable
actually, it's a
way to put the book together?
very helpful book. I think they've done a great job, and it's a valuable resource for people looking for a doctor. I think that there are other avenues that people should explore as well, certainly board certification, which John mentioned.
Tell me, obviously, if you're not in the book does not mean you're not a good doctor. But
of course
why
not.
is board certification so important?
Well,
and what is it?
Let me please also endorse what you just said, that I think there are some conspicuous absences. Sometimes people forget to fill the form out. I know some people that just, are sort of old-fashioned and they don't want to be in any books. As far as board certification, what board certification does is it ensures you a certain level of competency, specifically in plastic surgery, which is my field, and I get asked this a lot, particularly being in New York City and in Manhattan, because it's sort of a hotbed of plastic surgery. But it ensures that the doctor has not only gone to an accredited medical school, but has also completed at least 3 to 5 years of general surgery, followed by 2 to 3 years of plastic surgery and perhaps a fellowship after that. You can't even sit for the board exam until another 2 or 3 years have gone by.
Is this true with almost all the specialties?
Well, there's some variations between the specialties, but in terms of length of training, board certification in plastic surgery is certainly the longest.
And when you're looking for a board-certified doctor, there is a website, I think, that you can go to, which is what?
Yes. In fact, there are a number of them. The AMA has a website where you can look up some biographical information. That's the American Medical Association. The American Board of Medical Specialists has a website as well. They have 800 numbers that you can call. Depending on the state, you can get information from the state health department or education department. Some states, it's regulated by one or the other. And I agree with Dr. Antell. It's very important to check on board certification. 97.3% of the physicians in our book are board certified. There are some exceptions, but it really takes a lot to look into those people and be assured of their training. In New York State, for example, you can graduate from medical school, complete only 1 year of a residency, and then go out and hang up a shingle and call yourself a plastic surgeon, a gynecologist, a psychiatrist, a pediatrician.
Perfectly legal.
Whatever you want.
Well, that's kind of horrifying.
To put it in perspective, only 70% approximately of all doctors are board certified in anything. And what it means is that you might be board certified, but you might be board certified in an unrelated specialty. So that's the importance of checking board certification.
And those boards are kind of brutal, because my father is retired, but he is a physician. He was an oncologist and internist. Really? And I remember him studying for those boards, and I remember it was not pretty.
Yes. Well, actually, I think the Internet is another resource, which John mentioned, and I think that the site we should talk about, it's Certified Doctor, all one word, certifieddoctor.com. .org, O-R-G for organization. And if you type it in, it'll bring up what the doctor is board certified in.
Now, if you are calling, a friend recommends a doctor, or you pick a doctor out of the yellow pages or something, you should always ask if they are board certified. Will they tell you the truth necessarily?
Well, I think asking is only a place to begin, or asking a friend or the yellow pages. I mean, basically all you get is a name, or if you're in a health plan, a book with a name in it. You should do a lot more than that. Certainly board certification is one very important thing. And typically you can ask the doctor, but I agree that it's better to go and check it as well and make certain that it's accurate, or that in board certification hasn't lapsed, which happens these days as well.
So it's really the consumer's job to really educate themselves and do their homework.
You have to be an educated consumer, as Cy Sims would say.
Cy was never wrong. Now, how important is it to be you're at St. Luke's, is it to be a university teaching affiliation? How important is that?
Well, I think it's part of the equation. I think that people that are affiliated with a university generally are more active in research and are sort of on the cutting edge of things. But it's not mandatory. There certainly are many doctors that are not. It's simply one of the criteria. I also think I need to mention that with regard to the AMA's checking for board certification, they allow what's called self-designation. So although I certainly know how to use a stethoscope, if I wanted to be a cardiologist tomorrow, I could call the AMA and say I'm now a cardiologist, and that's what they would list me as. And in fact, although I'm board certified in plastic surgery, I could then advertise and say I'm board certified and conveniently leave off what I'm board certified in.
All right, see, now this is getting a little scary now. So tell me again, before we take a break, how the consumer, the patient, can protect themselves and make sure that this person is not just saying they are what they're not.
We'll use the certification website, or call the 800 number, which is in our book, by the American Board of Medical Specialists, or go to a library, a hospital library, a public library, and get the directories of the ABMS, and they will list all board-certified physicians in every specialty in the country.
Okay, and those websites are up on our screen right now. When we come back, I want to continue this discussion. I also want to talk about how to find a doctor in your HMO, because so many of us, almost all of us, have HMOs right now. So we'll be right back